The LUX Head and Neck 2 trial was a study of afatinib compared with placebo for patients who had completed chemoradiation for head and neck cancer and who had no evidence of disease. They could have been rendered free of disease by a salvage operation, or they could have had a complete response to the chemoradiation. The trial looked for patients who were high risk because they had P16 negative cancer, or among oropharynx cancer patients, those patients who had a smoking history that would have meant that their risk of recurrence was higher. The overall results of the study were negative. The study was stopped after the accrual of 617 out of a projected 669 patients because the DMC found that there was very little likelihood that afatinib would emerge as superior. We then undertook some biomarker analyses, and that made it appear as if there were real differences in how patients did by P16 status. Perhaps even had the trial been confined to P16 negative patients, the signal would have been much stronger. There also is evidence that if there's loss of P10, which is downstream from EGFR, which is the target of afatinib, that may also predict less benefit from afatinib. So overall, the trial was negative. I don't think people are going to start prescribing afatinib after chemoradiation based on these data. But I think the biomarker studies give us some hints of how this agent could be taken forward in future studies.